Hi, everyone. Welcome back again. So I'm excited to introduce our next presenter. We have Dr. Shawnée Daniel-McCalla. She is a pediatric clinical pharmacy specialist working in the neonatal intensive care unit at the University of Maryland Medical Center. Dr. Daniel-McCalla is also the PGY2 Pediatric Pharmacy Residency Program Coordinator here at the School of Pharmacy. She is originally from Brooklyn, New York. She completed her undergraduate studies in biochemistry at Oakwood University in Huntsville, Alabama, and went to pharmacy school at Loma Linda University in Loma Linda, California. After she completed her PharmD, she came across the country back to New York to do her PGY1 at New York Presbyterian, and then her PGY2 here with us at the University of Maryland School of Pharmacy in pediatrics. And she has a passion for precepting and is excited to help preceptors like her help residents manage burnout.
Thank you, Christine. Oops, it's off. Thank you, Christine, for the introduction. And like Christine said, I'm beyond happy to be here today to talk about what we could consider a hot topic in residency, which is burnout. As we all know, residency could be an incredible stressor in and of itself. It has been associated with burnout, increased perception of stress, and even depression. As we all know, our residents come into residency seeking more accelerated training, and that training requires an incredible amount of time and effort, which decreases the amount of time that our residents have available to dedicate to activities that could reduce stress. That, in combination with any kind of personal stress that our residents come in with, creates the perfect atmosphere for burnout to occur. So that's why talking about burnout is incredibly important. And it's important for us as preceptors and as residency programs in general to be able to prevent burnout, recognize burnout, and to help our residents to treat it. So in this presentation, we're going to answer 3 questions. The first is, what is burnout and how does it occur? The second is, how do you recognize burnout? And the third is, how can you help residents to prevent and manage burnout? So I'll be honest, I did a lot of teeter-tottering to figure out what is the best way to talk about this topic. And I figured, well, I'll take a page out of the book of our residents and start with a case presentation. So let's meet Marilyn. Marilyn is a PGY1 pharmacy resident in her 3rd month of residency. She did pharmacy school in Arizona and moved to the East Coast to be closer to home during residency. She is on rotation with you, and this is her first time having a rotation in your area of specialty. Due to her inexperience with your rotation topics, you decide to require her to do 2 to 3 topic discussions a week, an in-service presentation, and a journal club on this rotation. Of note, the hospital for your rotation is a 2-hour commute from where she lives with her family. Along with the responsibilities of the rotation, Marilyn works as a unit-based pharmacist every 3rd weekend for 10-hour shifts as part of her residency requirements. Data for her MUE project is due for review by her preceptors before the end of this rotation, since it is required for her to present her MUE as a poster presentation in the next 2 months. She just got feedback from preceptors for the first draft of her case presentation, who informed her that her first draft needed major improvements, and she has much to improve upon within a 2-week time span when the second draft is due. To stay afloat, Marilyn has stopped taking singing engagements, which used to bring her so much joy in pharmacy school. Marilyn feels overwhelmed and tired all the time and feels like she can't complete all of these tasks. She is emotionally exhausted from recent feelings of inadequacy, especially in the light of the feedback she just received. She is just overall discouraged. She doesn't know what to do and is occasionally experiencing headaches. As you can probably guess, Marilyn is experiencing burnout. Well, what is the prevalence of burnout in pharmacy residency programs? Well, in 2019, there was a survey that was published that was conducted in PGY1 and PGY2 pharmacy residents that were enrolled in a teaching certificate course. And this survey showed that 74.4% of residents experienced burnout. The following year, ASHP published a survey about resident well-being. And I'm sure some of us preceptors in the room remember when this survey came out. But essentially, that survey showed that 53% of residents were considered to be at high risk for developing burnout. In fact, 43% reported moderate to high risk of severe fatigue, and 57% reported poor work-life integration scores. So what does this all go to show? This shows that burnout is more prevalent in our residency programs, specifically our pharmacy residency programs, and it's more prevalent than we think. Well, what is this thing called burnout? Burnout is defined as a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. Burnout is more than just feeling blue. It is characterized by 3 different dimensions: emotional exhaustion, depersonalization, and personal accomplishment. And we're going to spend a little bit of time discussing these 3 dimensions of burnout. So the first one is emotional exhaustion. So this is also known as depressive anxiety syndrome. This is defined as a state of feeling emotionally worn out or drained as a result of accumulated stress. When someone is feeling emotional exhaustion, they could be fatigued at the very idea of work. They have chronic fatigue, they have trouble sleeping, and this could even manifest in physical problems. The second dimension of burnout is depersonalization. This is also known as a loss of empathy. The, Webster's dictionary definition of this is defined as an impaired and distorted perception of oneself, of others, and one's environment. And it manifests itself into an affective symptomatic lack of empathy. Simply put, someone experiencing depersonalization could have a feeling of unfeeling, or they can be very impersonal towards patients and colleagues. So these people that experience depersonalization could show things like excessive detachment, cynicism with negative attitudes. They can have feelings of guilt or avoiding social contact. And the last dimension of burnout is personal achievement or the lack thereof. So someone who is experiencing a lack of personal achievement has a tendency to negatively evaluate their work. They feel insufficient in regard to their ability to do their job. And they have an overall generalized poor self-outlook. They have a lot of negative assessments. They feel hopeless, they feel helpless, and they feel like they're unable to overcome their situations. So now that we have a good understanding, at least, of what burnout is, like I said before, burnout is not necessarily a new topic. It's a hot topic now in residency, but it's not necessarily new. So I'm not going to stand up here and bore you with talking about this whole thing the whole time. So we're going to have a conversation about this. So in anything that you've read or anything that you've maybe even experienced yourself, what are some causes of burnout? Anyone, feel free to raise your hand and unmute. I see the one in the back.
I would say overextending yourself, like not knowing your limits.
Excellent. Not knowing your limits. That's a really good point. That can cause burnout. Anyone else? Or anyone online? I don't know if anyone's commenting online. Not yet. Okay. Yes, right here.
Not scheduling or taking any time to like relax or take a breather, just being like on all the time.
Right. So not taking time to relax, not taking a breather, not scheduling that time or making time for yourself. That can also cause burnout. That's excellent. I see one over here.
Multiple nights a week without like enough sleep.
Excellent, right? Sleep impairment, right? Multiple nights a week without sleep. That's excellent. Anyone else? I don't know if anyone online. All right, long commute, long hours, and sleep deprivation. All of these are excellent causes of burnout. But now, since we're talking about this in the context of residency, let's discuss some causes of burnout, specifically in residency. All right, so I like to categorize causes of burnout in residency into 2 different categories. They can be circumstantial or they can be existential. So circumstantial means that it's associated with the work environment or personal challenges, whereas existential means that it's tied to internal dilemmas, right? How this person views themselves. So for a resident, this would be how a resident views themselves and their ability to become a pharmacist, a full-fledged pharmacist. So some circumstantial causes of burnout, some examples are things like lack of time for leisure activities, sleep impairment, interruptions or distractions, emotional stressors, a high workload or a high amount of responsibilities, or lack of control overall over their time. Some existential examples are things like feelings of futility, work conflicts, difficulty adjusting to new environments or even new experiences, lack of support, and that could be from family, that could be from friends, that could be from residency programs, it could be from even their co-residents. All of this can contribute to burnout. Also, lack of resilience is an example, and lack of recognition for one's accomplishments. So now that we know some causes of burnout in residency, let's go back to our case. So we know everything that's going on with Marilyn, right? So my question for the group is, what do you think caused Marilyn to experience burnout? Anyone can raise their hands and unmute, and we'll talk about some of these things. And it's some there on the slide, if anyone forgot the story. All right, I have one.
It's that 2-hour commute.
That 2-hour commute, yeah, that could be a killer. And that's one way, so that's 4 hours out of the day. Anyone else? Well, let me help you guys out. So she's a PGY1 resident, right? So this is a new adjustment. She's new to being a resident. She moved from one state to another for residency. So she's experiencing practice in a new state. That is also a new adjustment. This is her first time on your rotation. So that is also an adjustment as well. She staffs every third weekend. That is an increased workload. Multiple deadlines coming up. That's also increased workload. She just had a recent disappointment with the feedback that she received. This is probably the first time that she's gotten this degree of feedback before. So it's very, very discouraging. And she stopped doing her leisure activities. So these are some examples of things that cause Marilyn to experience burnout. So now that we know that she is experiencing burnout, or we know some causes of what caused her to experience burnout, how can we recognize burnout? So before we can talk about recognizing burnout, let's talk about why is it important to recognize in the first place. The thing with burnout is if burnout is left unchecked, you can have a lot of detrimental effects. These are things like depression, suicidal ideation, substance abuse, cardiovascular disease, and even an increased risk in patient safety. That's why it is important for us to recognize burnout promptly and to manage it once it occurs. Burnout also, like I said before, it's a tricky thing. It's not like it just comes up one day and you're like, bam, I'm in burnout. It happens in stages. So there are 5 stages of burnout. So the first stage is the honeymoon phase. So a resident starts their residency, they're pumped, they're excited, really happy to finally do the thing that they've always dreamed about doing, high commitment, high energy, ready for the year, super excited. Then comes the onset of stress. This is when the optimism starts to wane. Now you see some mild symptoms of burnout, things like fatigue, things like anxiety. I don't know how I'm gonna juggle doing all of these responsibilities and doing the stuff for the rotation that I have at the same time. Then that onset of stress turns into chronic stress. You see a marked change in these stress levels. And eventually that turns into burnout. This is where you see more of the marked behavioral changes that are associated with burnout. This person starts to be more withdrawn, start to feel like they have no power to address their situation, and they're just fatigued at the very idea of looking at anything related to residency. That burnout turns into habitual burnout, and this is where you see some of the significant mental, physical, and emotional problems. So what are these signs and symptoms of burnout that I'm talking about? So like I said before, this could be physical, this could be emotional, and this could be behavioral. So some examples of physical signs and symptoms of burnout are things like exhaustion, anxiety. You can see some GI effects, some disturbance in sleep, muscle pain, headache, changes in appetite. Some emotional signs and symptoms, at least some examples, are things like feeling helplessness, a sense of failure, feeling detached, having some self-doubt, reduced concentration, irritable at everything, and having a lot of cynicism. Some examples of behavioral signs and symptoms of burnout are things like being withdrawn, having an increased preference for isolation, delaying vocational tasks, and poor judgment calls in different decisions. So If we ask ourselves, since we are Marilyn's preceptor, so if we ask ourselves, is Marilyn experiencing burnout? I bet you every person in this room would say, yes, she is having some signs and symptoms of burnout. So some examples, she is feeling helpless, she's having self-doubt, she's exhausted, she has a sense of failure, she's delaying her vocational task because she's not singing anymore, and she is experiencing headaches. So these signs and symptoms could tell you that she's experienced burnout. The problem with relying on signs and symptoms to determine burnout is that you'll only know this if your resident decides to tell you this, right? You can't know what you don't know, right? Fortunately, there are some tools that we can use to help us recognize burnout. So these tools are the Maslach Burnout Inventory, or your MBI, or the Areas of Work-Life Survey, or AWS. And I'm gonna spend a little bit of time talking about these tools. So the first one is the MBI, and this is a questionnaire that is used to measure degrees of burnout. This is considered the gold standard in measuring burnout. This questionnaire has 3 sections, and each section correlates with the 3 dimensions of burnout. So just as a recap, these are emotional exhaustion, depersonalization, and personal achievement. And I have listed here what scores correlate with a high level of burnout. So just for fun, I guess, if we were to go back to our case with Marilyn, if she was to take an MBI, and I tell you she did not take an MBI, but if she was to take an MBI, her result would have been a 22 for section A, which indicates moderate burnout for section B, and high level burnout for section C. So if she was to take this, you would see, okay, definitely this resident is experiencing a moderate to high level of burnout. The other tool that we can use is the Areas of Work-Life Survey, or the AWS. So this kind of works hand in hand with your MBI. So just to recap, your MBI tells you the degree of burnout. What the AWS does, it helps you to pinpoint what area in the work environment might be contributing to this burnout. And it looks at a bunch of different factors. The first is the workload. So this looks at the amount of work that's done in a given time. So this captures the extent of how your work demands spill into your personal life, or social pressures, or any kind of physical or intellectual burning of your job. The next one, it looks at control. So it looks at the opportunity of a person to make decisions and things like that. So it looks at their overall professional autonomy. The next, it looks at rewards. So it looks at, is this person being recognized for their contributions? So these could be things like praise, awards, perks, even increases in salary, even though I know that's hard to happen for residencies. The next is, it looks at your community, right? So this looks at the quality of your social context. So this looks at your relationships with people. This could be your managers, your colleagues, your subordinates, and even your patients. Another factor it looks at is fairness. So this is the quality and adjustment of respect at work. So it looks at the organization. In this context, it will be your residency program. And it looks as if they have consistent and equitable rules for everyone. And the last thing it looks at, values. What matters to you? And not only does it look at what matters to you, but it sees if your values are consistent with your program's values. All of these put together can help to pinpoint what exactly it is that is contributing to someone's burnout. So these tools, both of them, could help us to recognize burnout. So then the question still stands, how can we as preceptors help residents like Marilyn deal with her burnout? Well, I'd like to begin this section with a quote from Christina Maslach. As you notice the last name, she's the one who helped do the MBI, and she's published a lot of data and research going into burnout in the work setting specifically. But she has this quote that says, if all of the knowledge and advice about how to beat burnout could be summed up in one word, that word would be balance. Balance between giving and getting, balance between stress and calm, and balance between work and home. Well, the question is, how can we help residents establish balance? Well, the first thing that we can do is identify your residents' specific needs. How can we know what the problem is if we don't even know what the problem, if we don't even try to figure out about the problem? So easily put, how do you figure out what the resident's specific needs? Talk with them, right? Have multiple check-ins with the resident. Ask them how things are going. Ask them what their frustrations are. In order for you to have an effective conversation, you do need to create a safe space for residents to be able to express their frustrations. Now, I would say that creating a safe space is not one fits all. Not every resident is comfortable with expressing their frustrations in all different kinds of settings. You may have some residents where it's like, it doesn't matter who's around, I'm gonna say what's going on, I'm gonna say what's frustrating me, right? But you do have some residents that don't prefer to say this in a group setting. They probably would prefer to have one-on-one discussions. So you may have to have one-on-one discussions with that resident. And then you might have some residents that don't feel comfortable at all just voicing concerns to anyone. So if you have a structure in place that enables them to anonymously submit frustrations and concerns, that could also help those residents get their needs out. But if the resident does come to you and you are having conversations with them, it is very important to practice active listening. Make sure that you express that you are giving them your undivided attention, that you're dedicating time really just to spend with that resident. You've already created a space where they are more comfortable to express their concerns. And in that active listening, make sure that you affirm to the resident that their needs are heard and considered. It goes a long way for someone to understand that they're being heard. And I get it. Sometimes in the residency program, it's hard. It might not be a situation where you can make a specific change to something that's a frustration. But if you even take the time to explain, well, we're having you do this task because of X, Y, Z, and these are why these things are required. When a resident goes back to do that task, at least they have a different framework for what they're about to do, and they might be more committed to doing it. So understanding the resident's needs goes a long way. So, like I said, we have a case, so let's do some practice. Based on everything that we talked about with Marilyn, if you look at her case, what would you say are Marilyn's needs? And anyone, feel free to raise your hand or chat on the Zoom online.
She needs to move.
She needs to move. Exactly. That long commute is insane. So she can move. Anyone else? Right. So the resident needs work-life balance. They need help with organizing. Anyone else? Yes, over there. Mm-hmm. Right. So she was saying that sometimes it helps to schedule leisure time right into your schedule to make sure that ensure that happens. So I kind of summed up some of Marilyn's needs, right? So she's adjusting to a new rotation, adjusting the pharmacy practice. That commute is too far. I didn't list it on there, but that's a great one. She has multiple deadlines at the same time. She's not practicing wellness, most likely not sleeping much because of that long commute that she has, low self-image, and she is having some physical problems of burnout because she is experiencing headaches. So how can we even manage burnout in general? So essentially, there are 3 rules of thumb. The first one is preventing burnout is a better strategy than waiting to treat it after it becomes a problem. The second rule is building engagement is the best approach to preventing burnout. And the third rule is that organizational intervention can be more productive than individual intervention. And we're going to spend some time talking about these 3 rules. So the first rule, like I said, is revolving around preventative strategies. And really the best way you can prevent burnout is by building resilience, in your residents. So resilience is defined as the ability to bounce back and recover from stress. And this is composed of 4 different core components: connection, wellness, healthy thinking, and meaning. So we're going to talk about these different 4 components and talk about how can we as preceptors and as residency programs as a whole build up resilience in our residents through these 4 core components. So the first one is connection. So simply put, this is just working on building and maintaining healthy relationships. Those relationships can help to provide support to residents when they're in stressful times. So things that we can do as preceptors are, one, build a mentoring relationship with your resident. At the beginning of your rotation, establish that you can be a source of advice for that resident, and this is for anything that they need. And residents, this is also consistent for you as you precept students or PGY2s, as you precept PGY1s. You could also be a mentor to those as well. The next is, if a resident confides in you with things that they need help with, and if that is beyond your scope, really encourage your residents to join support groups or use the resources that are available at our institution. Next is share your experience with the resident, including those concerning burnout. Sometimes just telling the resident your story can give them encouragement to know that, hey, if you got through residency and you had these similar experiences, I can get through it too. So share your experiences with the resident. And lastly, as a preceptor, you can be the example. So you can show them these are some healthy ways that you can manage burnout. Just looking at you as an example can go a long way. Now, things for the residency program, the first thing you can do is to host team building events throughout the year. This would give multiple opportunities for residents to build relationships, not only with each other, but with preceptors, and they could identify some other mentors on top of the ones that they have identified as part of the residency program. Some other things we can do is inform residents about stress management programs at the institution, and also develop a mentoring program. So I know our program at UMMC and School of Pharmacy, we already have a mentoring program. So if your program does not have a mentoring program, this is probably a good idea to do, because this would help to formally give a resident a mentor so they already have a point person to talk to about problems. And lastly, get to know your residents. Encourage all your preceptors, all your RPDs, all your coordinators to spend time and talking with the residents and get to know them better. So now that we've discussed connection, let's talk about wellness. So wellness or fostering wellness could be an incredible tool to help to manage stress. So things that we can do as preceptors, one thing, and this is something that I started doing on my rotations, is to add a wellness goal to your list of goals for the rotation. I know in the beginning for multiple of us for our rotations, we always ask the resident, give me a list of 3 goals that you want to accomplish for the rotation. Well, add a wellness one to the list. And then when you have your feedback Fridays, check in on those wellness goals and see if they reach that goal. So these wellness goals could be something like, okay, my goal for this rotation is to work out at least twice a week on this rotation. Well, on your feedback Friday, ask them, okay, did you get to work out twice a week? No, you didn't. All right, next week I want you to at least work out once, and build up until they're able to do it. And this is one way that we can ensure that they have some form of wellness on your rotation. Another thing that we can do is consider incorporating mindfulness as an activity on your rotation. So this might mean like once a week, taking 5 minutes just to pause and reflect on the week and reflect how things are going. This could be incredibly helpful on ICU rotations, for example. I know we just had that talk about death and dying, but when you have these situations happen, it's very important to take time out with your resident just to decompress and express emotions about things that transpired on the rotation. Things from a residency program perspective, things that we can do is measure burnout and well-being periodically. Throughout the year, use those tools that we talked about to grade the residents so that they can self-identify, hey, I'm probably not, where I should be. I'm like experiencing moderate burnout. So at least we can recognize that so they'll know, hey, okay, now it's time for me to do some intervention. Other things that we can do is institute wellness initiatives and activities into the year. So have activities that makes residents be physical, right? And preceptors join too, because we're not limited from burnout either. So all of us should do some kind of exercise activities, promote healthy eating, either have seminars of it, or at your events, have some healthy choice options. Promote rest and taking time off. Anyone who knows me, I'm a component to always encourage anyone. If you take your time off, and I have to talk with you guys later on in the year, if you have your time off, use your time off as time off, not to catch up on residency activities. So make sure and encourage your residents to use their time off effectively. And also, lastly, for a residency program, you can offer facilitated group discussions. Just give a forum for residents just to feel comfortable to just express their emotions or express their concerns. The next component is healthy thinking. So things that we can do from a preceptor to promote healthy thinking are, of course, positive reinforcement. Tell the resident something that they've done well. Encourage them to continue doing things. So positive reinforcement can go a long way. You can also encourage residents to seek counseling if you do see unhealthy thinking. So encourage them to use these counseling services. From a residency program, again, positive reinforcement could go a long way, and it could go even further when it's on a higher level. And I know a lot of times in residency programs, we do this at the end of the year when we give certificates and stuff like that. But this positive reinforcement does not have to wait until the end of the year. Recognize your residents throughout the year for things that they've done and things that they've done well. You could also conduct seminars on mindfulness, communication, self-awareness, and also give emotional intelligence training. So all of these can give residents a tool to be self-aware of their situation and understand, hey, something's not right with my emotions right now. Something's a little bit off. It's probably a good time for me to seek some help or seek some advice on things. And the last component of building resilience is meaning. So this focuses on why residents chose to be in residency in the first place. I'm sure if you ask any of us when we were residents or any of these residents here, and you ask them, why do I even want to do residency? A lot of times the answer is, I'm coming here to help people. So the best way to reinforce meaning is to help them help people. So as a preceptor, one thing that we can do is prioritize patient-centered work. I know a lot of times as preceptors, it's very hard to just not only focus on the checklist and get everything done on the checklist, and they have to do these type of discussions and they have to do these journal clubs, but really they came here to spend time with patients. So if you prioritize patient care, that would help reinforce the meaning. Also, be attentive to your residents' workload. So sometimes we come in bright-eyed and bushy-tailed, ready to do the rotation, and we have a list of things to do, but sometimes we're not cognizant of other things that the residents have going on. So I would encourage at the beginning of rotations, ask the resident about what deadlines they have coming up on your rotation, and then structure your rotation to accommodate those and also accommodate the goals that you have for your rotation. And lastly, advise the resident on career planning. So sometimes we can focus on the rotation, but let's talk about what's the next step, right? If you have a PGY1 going into PGY2 and they especially want to go into your area of specialty for PGY2, give them advice on some stuff that they can do to prepare for PGY2, or PGY2s that are getting ready to go out and be a full-fledged clinical specialist. Give them tips on how to pass the board exam. Tell them what are some tips and tricks you learned in your transition from being a resident into a full-fledged practicing pharmacist. So all of that can go a long way. For the residency program, things that we can do to kind of help them focus on patient care is to relieve residents from unnecessary non-clinical duties, right? So really assess all of the activities that you have required for your residents to the ones that are absolutely necessary for them. And also teach healthcare and social systems literacy. Like I said before, a lot of us go into this profession in order to help people. And if you teach about healthcare and social systems literacy, it kind of would give our residents the tools that they need to be better pharmacists or to be more socially aware pharmacists. So now that we've covered Rule 1, which was preventative measures, we're moving on into Rule 2, which is building engagement. So how do you build engagement? One way, or the best way to increase engagement, is by identifying areas of interest for residents. So you can do this in multiple different ways. Some examples are having varied residency experience, having mentorship programs, like I said before, having program recognition of the resident. But the biggest thing that I want to highlight is resident autonomy. So how can we increase resident autonomy, both from the perspective of the preceptor and from the residency program? So some examples are, when you have a resident on rotation with you, tailor the rotation to your specific needs. This can also qualify for the residents who have a student on rotation. Maybe that student only wants to do outpatient stuff and you're all inpatient, or you're on an inpatient rotation. Try to highlight those skills that are general for pharmacists in general, or highlight some of the, okay, well, these are some discharge things that could be helpful, and give them tools so that would keep them engaged in your rotation. And also they have there'll be the ability to, make the opportunity more relevant to them. Also, you can allow them to pick their own topics on rotation projects. If you have a journal club or an in-service or something like that on your rotation, allow them to pick that topic. And the biggest thing I want to say is to allow them to develop their own practice on your rotation. Matt said something in his presentation that I totally agree with, which is you're not trying to turn them into a clone of yourself. They need to be their own practicing pharmacists. So give them the room to take the lead on things. Give them the room to figure things out. You can give them tips and tricks and advise them on how you would do things, but allow them to develop their own practice. For the residency program, things that we can do, and these are some things that we've already been doing, but you can have the residents select projects, select their own presentation and project topics. You can have flexibility of different rotations. And, sometimes things change. A resident might come in and say that they want to do something like ICU, will then switch and be like they want to do peds. So you can make sure you have some room to alter their rotation for those new interests. And also, lastly, you can ask the resident themselves for input on changes to the program, especially when it comes to things regarding wellness. This can help to make the most relevant changes in your program. So the last rule that we're going to talk about is organizational intervention. And this pretty much revolves around creating a positive work environment. And as you know, there's a lot of things that have been published about creating the best positive work environment. And these are things like having flexible work hours, enhanced job security, ability to have parental leave, protection from exposure from occasional risks, prevention of sleep impairment, respecting time off, and preventing interruption. So I know a lot of our programs have things in place to address some of these concerns, but the one thing that I want to highlight out of this is preventing interruptions. So how do we prevent interruptions? The one thing that I want to say, for any activity that you have on either your rotation or an activity that we have structured for the residency year, make sure to ask yourself these 3 questions. The first question is this task enriching for the resident? Would this help the resident to achieve their own personal goals? The second question is this task supportive of the program's objectives? Simply put, does this help us to address all of the components that ASHP has set out for us to accomplish? And then thirdly, is this task meaningful for the resident and program? If you ask yourself these questions and the answer to all of these questions is no, it is not a helpful activity. It is therefore an interruption. It's very important for us to evaluate all of our activities periodically to see if they're helpful for the resident or if they're hurtful. So back to Marilyn. How can we help Marilyn to manage her burnout? So we talked about Marilyn's needs and things like that. So based on everything that we talked about, different suggestions that can help this resident. If we were to practice and look at Marilyn's needs, what are some things that we can help from either a preceptor standpoint or even from a program standpoint? Feel free to raise your hand and unmute your mic. Or message on the chat online, either one. Yes, back there.
Reschedule her case presentation. She needs more time to work on it.
Right? So that might involve rescheduling the rotation, exactly. Okay.
I was just gonna say, maybe it's just some positive reinforcement, some encouragement.
Right. Give her some positive reinforcement. Highlight some things that she might be doing well, especially since she's feeling discouraged with the feedback that she just received. That's excellent. Any other suggestions? Are there any online? I don't know. Okay. Right? Exactly. Schedule karaoke. So schedule a leisure event. Give her an opportunity to, get into singing again. Meet with her more often, right? So that could be either her mentor or a preceptor or RPD, anyone. Meet with her more often to check in and see how things are going. Say again? Right. Help the resident to plan a wellness activity during the rotation. That's excellent. Another thing you can do is you as a preceptor could be a mentor. So I help her to, navigate those conversations to, switch some deadlines to help free up some of that time, right? Even if it might be hard for her in the middle of the year to move to another location, right? So a suggestion was that commute is too long, but some things that you can do to kind of flex that time is give her some of availability to leave a little bit early, do some stuff to work from home. She can kind of beat some of that commute, maybe do some virtual topic discussion to kind of help accommodate that commute that she has, stuff like that. And if she is really burnt out, it might mean giving her a project day to kind of catch up on things too as well, or take a day off, right? Let her take a day off to kind of help those things. And encourage her to be as autonomous as possible, because she is feeling discouraged by her ability. But if you push her to, hey, take the lead on this, do this patient counseling and stuff like that, and affirm her, eventually she'll build in her confidence to say, okay, yeah, I can do this. I'm a great pharmacist. I can do this. So a story isn't a story without an ending. So you might be wondering what happened to Marilyn. So Marilyn did talk with her mentor and expressed her frustrations, and she got advice. She did talk to her preceptors about shifting some of the deadlines to prioritize the more pressing projects. She also asked a PGY2 resident, hey, what's some advice about conducting and preparing presentations? She also started doing singing engagements again. She successfully completed all of her assignments, and she survived her rotation. And for a fun fact, Marilyn is me. This is a true story of something that happened to me when I was a PGY1 resident. And I did not know that I was in burnout until I was in burnout. So this is why it's very important for us to recognize and manage them when we see them, because I probably wouldn't have had all the headaches and all the stress and all the other things that was going on if I had recognized this a little bit earlier. And just to summarize some of the points that we talked about today, I like to use the acronym by the Crichton University Initiative. So if you want to remember anything that we talked about today, the easiest way that you can help residents to manage burnout is to see, celebrate their successes, and prevent negative thinking. H, encourage your residents to hear about other people's experiences. E, encourage them to speak with experts about wellness. E, to engage your residents to present their own ideas. And R, recharge the residents with anti-burnout strategies into their lives. So remember, cheer. These are my references, and I'll be happy to answer any questions. There's no questions? Okay. Any online?
I have a questions.
Yes.
Hi,
Yes.
do you really drive 2 hours to work?
Did I drive 2 hours? I did. So this was in New York. So I was commuting from Brooklyn to Manhattan. And specifically, this rotation was ICU, which was basically in the Bronx. So it was a 2-hour rotation, and I had to be there at 6 o'clock in the morning. And, you know, ICU is long. So basically, I was only getting, I would say, 4 hours of sleep a night, trying to finish everything and stuff. So was not a happy time, honestly. And it was a train. It was a train. Uh-huh.
How do you think like generational sets like Gen Z versus millennial versus baby boomer, like how do you think that that plays a role into, I don't know, resilience and burnout and all of that?
I think that's an excellent question. Because I would say, just anecdotally, I think each of these generations have a different outlook on the value of a job specifically, if that makes sense. I feel like the older you are, the more committed you are to just struggle and like get through and just push through and to, you know, not say anything, just struggle, get through and move on. Whereas I feel like the newer generations, they're more likely to express their frustrations and say, hey, this is not cool, this is not okay. So that does play a part into it. But us as preceptors can still create that atmosphere to give anyone in any one of those generations the ability, empower them with the ability to, you know, express their concerns and frustrations. That's a really good question, Vinny. Yes, right there.
So I just wanted to ask, how do you incorporate, or how do you find the time to incorporate some of these wellness activities into your rotation? I feel like sometimes our residents struggle to even get like their basic daily tasks done for the rotation. And then of course they have other time away from the program or the rotation for like longitudinal things, meetings. So oftentimes we feel like sometimes our residents even have too little time to even do like our basic, you know, day-to-day pharmacy workflow things that have to be done. So I just wanted some advice on that if you have some.
So one thing that I've started doing personally is in their calendar for the rotation, I literally pencil in time on my feedback Friday, let's take some time, sit down, let's reflect. Let's talk about this. Let's, give them some time to express things that they've done well, express any frustrations that they have. So at least in my rotation, I have at least a time for them to talk about it and express things, right? Something that I'm even challenging myself to do, if I have time, if me and my resident could do something together, that is a healthy activity. That is one way to ensure that they'll do it. Because if they have a meeting with someone else, they'll be more likely to do it. Or I'll encourage them to, try to pair up with a partner, maybe a co-resident and stuff like that. So if the more people to do that activity, the more kind of social pressure, if that makes sense, would encourage them to be more consistent when doing some of these activities. That's an excellent question. Thank you. Mhm. Okay, if there are not any more questions, thank you all for your time. Oh, there's one more? Okay. How long did it take for me to recognize I was getting better? It took me a very long time to recognize that I was getting better, to be honest. But I think once I was able to offset some of the tasks, I felt myself experiencing less headaches. I was happier.